November 27th at 10:50, and I will be performing my female Foley catheter video. So before I walk into the room, I'll make sure that I have the order from the doctor to insert the catheter. I will have grab the catheter kit necessary with the right size, and I will enter the room. When entering the room, I will make sure I have all my supplies close by, trash can, and bedside table that is cleaned off with Clorox wipes before opening my catheter kit. So when I walk into the room, I will introduce myself, do hand hygiene. Hi, my name's Tress. I'll be your nurse today. Can you tell me your name and date of birth?
Stacy Henderson, 12/12 of 96.
Okay, that is correct. I did 2 patient identifiers. I'm going to ask, what are your allergies?
I don't have any allergies.
Okay, so I'll be using betadine and lubricant on you today, so just making sure you weren't allergic to anything like that. Have you ever had a catheter placed before?
No.
So I will just be placing the catheter in your urethra. It's a flexible tube that will be placed. It will help with your urinary retention and just for adequate eyes and nose. So, any other questions for me today?
No.
Okay. I will provide privacy, and I'm going to pull down the blankets. I'm going to spread her legs, pull her gown up. I will have performed adequate peri-care at this moment with clean gloves, removed my gloves, and performed hand hygiene again. So now that she is ready for her catheter, I will open the package away from me, the sides, and towards me. I'm going to move it. So I have the pad that will go. Okay, so now that that is under her, I am going to put my sterile gloves on without turning my back to my sterile field or my patient. Before putting these on, I'm going to raise the bed up before I forget. Okay. I'm putting sterile gloves on. Without using my thumb, I will throw that in the trash can. So I will not be using this cover, so that I'll just set that off to the side. Now that I am sterile, I'm going to set up my equipment. I'm going to attach the 10 ml syringe to the catheter, which some protocols say to inflate the balloon prior to inserting, but I will not be inflating the balloon first. Gonna open, we use, the mannequins don't use normal lube, so I open the lube up. I will open the betadine package, which we also don't use on the mannequins, up and pour that over the cotton swabs. So now I'm going to take the catheter sheath off. And then, so I'm going to just stick this in the lubricant while I am cleaning the peri area. So normally with actual patients, you would have the lube in the container, and I would just lay it into the container. So I will grab a cotton swab that has betadine on it. I will spread the labias. I will go away from me in the outer labia, throw that away. Toward the outer meated towards me. Intermediate or labia towards me. again and straight down the middle. Since this hand is now contaminated, I will pick up my catheter. I will insert the catheter into the urethra. Once I see urine return, I will advance 2 more inches, and I am going to inflate the bulb with 10 mils of normal saline. I can now use this hand to disconnect the syringe, and I will now hook this up to the side with her leg with a cap securer and hang this to the non-movable part of the bed, making sure it does not touch the ground. I'm going to date and time the catheter kit with when I put it in, how much is in the bulb, and what size. I also document later on in the computer what the urine color looked like, the amount that came out, and if she was any discomfort or anything she experienced during the procedure. I'm now going to make her comfortable again, cover her back up, and lower the bed down.